Hello and welcome to Cook County Ophthalmology. I'm Lisa Thompson, the program director here in ophthalmology at Cook County Health in Chicago. I'm delighted to provide a virtual welcome to our residency program during this interview season. Our goals in residency are to provide outstanding clinical training to produce well-rounded ophthalmologists and to help our residents achieve their goals after residency, whatever they may be. Our collective county mission is also to provide excellent care to patients regardless of their ability to pay. This video compilation of current and past residents and attendings will give you a glimpse of what it would be like to train here with us.
I chose to come to County because when I came here, I felt like I was part of something much bigger than myself. The mission of this institution is to provide competent care to people that wouldn't otherwise get it, and make sure that all these patients don't fall through the cracks of our healthcare system. The cultures here are incredibly diverse and very beautiful. The pathology here is extremely complex, and sometimes that can be very frustrating and difficult, but I feel like every single day these patients push me to do better, give more, and ultimately to become a better physician.
I think the thing that really sets Cook County apart is that the patients are really your patients from the time you step in the door. So there's no such thing as really an attending clinic. The general clinic is really run completely by residents, and the patients really get to know you as their doctor even from your very first year on. And so you really get to build relationships with your patients and see how they place their trust in you when they may not have access to other places for care. And so they really appreciate the care that you are able to provide them. And it makes you want to be a better doctor because you know that they're relying on you for their medical and surgical management.
Our first year spend most of their year in our resident-run clinic, where they get to see a complete mix of subspecialties every single day. By the end of the year, I think most of the residents feel great at seeing any type of eye patient. We also get to be proficient at doing intravitreal injections, glaucoma lasers, as well as minor plastic procedures. We also get early exposure to the OR by seeing cataract, strabismus, and refractive cases.
I think the comprehensive training that you get at County is just really astounding because you are so comfortable with every problem for a patient because you see the same patient for every one of their problems.
So I love Cook County, and I knew that I wanted to come here after my medical school student rotation. I really love the working environment. All my co-residents are great, and the attendings are super supportive and really put our teaching and our learning as a priority. I think as Cook County is a safety net hospital for the third largest city in America, we take care of the most at-need patients, and our patients have very extreme severe cases of pathology and have very rare diseases that most people will only ever read in a textbook.
The uveitis clinic at Stroger is one of the busiest, and we see a wide variety of pathology, including TB, syphilis, sarcoid, ANCA-related vasculitides, and manage patients with numerous medications that you will be comfortable managing at the end of your residency. I think this is a pretty unique asset to this program, and that we see this type of pathology, and as a first-year resident in the clinic, you will gain confidence in managing these patients.
As second-year residents, we get to rotate through 4 unique blocks. Our first block is retina, where we get to work one-on-one with medical and surgical retina attendings for 3 months. Our next block is consults, where we hold the pager and answer pages from internal medicine, emergency medicine as well, and get to see really complex and interesting pathology. At our Blue Island rotation, we get to perform about 40 to 50 cataracts as primary surgeon. Our last rotation is clinic chief, where we get to help the first years grow and operate as the main person for clinic.
This is a very hands-on residency program. Our residents do things that I would have loved to do when I was a resident. They follow patients from beginning to end. They see really complex pathology. They have a lot of really good hands-on surgical experience. They're really, really vested and interested in all of their patients, and they're some of the smartest kids I've ever worked with. They work really hard, they study hard, they do really well.
Another thing that's really emphasized at County is mentorship, and you really, it's such a great community of mentors between attendings and residents and we all keep in touch, even years later, which is nice and unique. You don't see that in every program. So.
Another part that's great about being here is the patient population. Patient population here, we see 50% of patients who are underserved, meaning that they're self-pay or they have no insurance. And so we take care of that vulnerable population here in Chicago. And that's a very fulfilling part of our job. And it's something that, I will always be thankful for that I had the opportunity to do.
I am a cornea specialist here. I did my training at Mass Eye and Ear, and I joined Cook County about 6 years ago. The beauty of what I've noticed here is that you have the opportunities for autonomy and to run with what you learn, but you're always supported. You have every kind of subspecialist around you. You have, your more senior residents and the fellows that are around that are another resource for you. And so there's always somebody to ask when you want more direction. And I think it's a beautiful balance for learning. And it extends directly to surgically, the surgical training. You really own your patients, you follow them, and we help you every step of the way.
Even as a resident, patients, when you're consenting them for surgery, patients would sometimes stop and they would look at you and they would say, "Are you going to be doing my surgery?" And I would say, "Yes, it's going to be me. The attending will be there." But and the patient would say, "Good. They wanted me to be doing their surgery." And that's because they knew me and they trusted me.
I love County. I feel like you work so hard and you see so many things. And so I'm where I work right now, I work in a county hospital in Indianapolis, and then I do a lot of general staffing. So even though I'm glaucoma, but those general days, we have horrible corneal ulcers, horrible uveitis, horrible retina, and I feel like I can handle all of it. Even though I'm glaucoma, I still feel comfortable staffing all of that, and I'm able to direct it and treat it. And I think that's just so much because of, while our 3 years at County, you literally see everything.
So I think I've had the fortune of training at a bunch of different places. I went to med school at Rush. I did my residency at Cook County, and I've done fellowships at Mass Eye and Ear, and I'm doing another fellowship in vitreoretinal surgery at Mayo Clinic. And I think what really sets Cook County apart is from day one, there's a lot of autonomy and ownership that we have over our patients. Because of my county training, I felt completely confident from the very first day after leaving my residency.
We here at Cook County Health are proud of our long heritage of both exceptional training and patient care. Stroger Hospital in our main campus was recently named among the top 50 teaching hospitals in the United States by the Becker Hospital Review and the Washington Monthly Magazine. Thank you for joining us on this virtual tour. We look forward to meeting you soon.
I love y'all in the ophthalmology department. Y'all have a blessed and wonderful